CPA is tonight.
Snowed in.
Snowed in, there's no doubt.
Didn't have that 5 o'clock again.
Flags, sort of flag at the back, please. I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Nice to see we have a little bit of the public here tonight. It's our agenda item to take public comment at this time, if anybody has any. Myron, you got something?
Yes, I guess I do. I think I know most of you, but my name is Myron Stewart, and I was born in the previous hospital, so I've been here a while. I can remember when Mabel McDonald ran the whole show there, and the doctors owned the hospital. And it seemed to work out quite well. And I'm just here to remind you, and I'm sure you're all aware, and I thank you for your service, that you're here to serve the public health needs in the most efficient manner you can. Yeah, you have the facilities, the people to do a great job, but you should be able to compete with private enterprise. And I recently got a bill for getting a shot in my knee because I can run 2 seconds faster that way. $200 more than private enterprise. That's wrong. If anything, you're government supported, you should be less expensive, more affordable to the public. And I think that should be a goal you should shoot for. We're very fortunate to have the doctors, the nurses, the facilities to serve Lake County, and I think we should try to do our best by it. Thank you.
Can I ask a question, Myron?
Yes,
Was this service performed in the clinic?
Yes,
Okay.
same clinic, same, it takes 5 minutes.
I've had it done.
Yeah, I'm sure you have. So anyway, I brought it to the attention of hopefully the people that can handle that for me. But I just wanted to bring it before the board.
All right, thank you. I think it's a good thing to discuss.
Myron, how long was it between the one shot with one price and one the other? You know, approximately?
Well, let me look.
Well, are we talking weeks, months?
Months.
Months, okay.
Yeah, I can only get one every, they got me on a schedule. They don't want me to become a junkie.
Yeah. That price that might only be half as often.
Well, I switched knees.
Oh, was it the same doctor that performed?
Yes.
Okay,
Yes.
we'll discuss that later. All right, thank you.
You're welcome.
Anybody else? Karen, did you have anything you wanted to discuss? No? Cheryl? No? All right. We'll move on then to our agenda, consent agenda. We got minutes later.
Yes, we did.
Does anybody have anything that needs discussing there? If not, I'll entertain a motion.
I apologize for the delay because we just didn't get it done last week. So,
Also move that the agenda items be approved as presented.
I'll second that.
Moved and seconded, those in favor?
Aye.
Aye. Did I
But
hear-
I just want you to know that Jen wasn't the delay.
Oh, okay.
You guys heard that part, yeah.
Did I hear an eye on the end down there?
Yes, you
did. All right, that's approved then. November 2015 financial report, Cheryl.
year, we have seen 77 fewer patients than we did last year at this time. That is a 3% decrease. Sorry, those. Okay, so we're looking at our stats. November's in the first column, year-to-date is the first green column. I'm looking now at the hospital patients. Year over year, our ER is down by 49 patients. That's this number right here. This is the number I said, we're 77 less than last year. That's only 3%. It's not too bad. But radiology is down a bit and the emergency department is down a bit. Looking then at our ancillary services, radiology is down a little bit. It's a 2% decrease for them. On the other hand, rehab is up by 556 patients, which is a 26% increase. Wow. So, good news. Home health is doing well. The health clinics continue to be busy. And nothing else is really radically moving down there. Which is good, we don't want to have more longer room to stay.
If I can just comment as well, Amron is here, about why our rehab visits are up. When Amron became our manager, how long ago was that? 2 years, almost 2 years ago. He came to me and said, here's my plan to help us find replacement physical therapists. And it was an aggressive step because we couldn't get people. And so we worked very hard. Amron recruited and used some people to help us. And then he came to me and said, well, if we're having this kind of success, how about, if we can't get them here yet, how about we start with temporary people? So we had locum tenens or the agency people. And that helped build up our volume. We also started doing twice-a-day therapy in the hospital, which helped speed up the recovery time. We have added and added. We looked at doing occupational therapy. Amron said, I'm not sure we have enough work, but I think we will. We can't get a part-time person, so we hired a full-time. And our full-time person has been constantly busy, and it's been excellent. So with Amron's hard work and diligence in finding good people, you can see the difference. So that's been excellent.
So maybe this question then would be for Amron. The facility, is it okay to handle that additional load?
So
Do you
recently,
schedule more? How does that work?
we just reacquired what was the old ICU back from pulmonary rehab. So with their move over, we did acquire that space, which helps alleviate some of our congestion. We're probably running at capacity right now with the volume of patients we're seeing and the number of clinicians that we have as far as PT and OT goes. My biggest problem, and Charlie is well aware of this, is I have a displaced speech-language pathologist. So I need to find a room, a home for my SLP that's that she can do her treatments in. So that's been kind of an ongoing battle, which is something that kind of stepping ahead, and maybe we can go out of order a little bit right now, but something we're going to have to plan for in the future, and Charlie and I do have a few ideas for where we need to go with that. But that's the next step with our rehab, is trying to partner with the school district and be a little bit more aggressive about speech-language pathologists being here and helping out with our caseloads. So, but yes, to answer your question, I don't have enough room, but Charlie informs me every day that I'm trying to take over the world. So,
Well, you know, last summer we did a venture with Hunter Hot Springs so that we could be able to do water therapy. And that's something that Amron's been working. So, you know, we just keep working and finding ways to help improve and get our community back.
our latest is pelvic floor rehab. So we started a program. I brought back Annika. Most of you know her, and she's working one Saturday a month, and she's a women's health pelvic floor specialist. So she's doing our evaluations and our reevaluations, and we're continuing treatment there. So that has been very successful. Her caseload is full, so that will, I can see, 10 to 15% increase in our caseload because of that. And I think it will only improve as we get more results. So
I just wanted to, you'll see the numbers speak for themselves.
Okay, average monthly revenue continues to grow. The current average monthly revenue is at 2.35 million. Our revenue for November was below that at 2.23 million. This is our days in accounts receivable. This is where we are right now. That number is 78. We're basically at an average for 78 for the year. We are down from last month, which is good news. We are down in spite of the fact that November was a very low month for AR collections on our receivables. I sent all of you, I feel like we're constantly giving you reasons why we're having problems with days in AR, so we decided we would start a spreadsheet so that we could kind of be more transparent and accountable for what we told you. And when we told you it was going to end, and we can let you know when new things come along that cause us pain. At this point, we've hired new staff, they're replaced, they're in training. I don't see another thing coming along that should cause us as much pain as we've had in the last 2 months. We will be unrolling eClinical up here in February, I think, or maybe March, which causes some pain, which would be significantly less than the problems we've had in Alturas, because we're all learning from our mistakes and problems in Alturas. So I do think that this will continue to improve in the coming months. Okay. Oops. Go. Okay, our days cash on hand is right here. As I said, the cash collected in November was pretty low up against our accounts receivable, but cash went up rather well because we had our tax deposits for the year and because Lakeview Gardens paid back some of their debt. So we had a very good cash month, just not on AR. So that went up. I'll see where I wrote the number down, but I think it was 158 or so. The other good news is that while collections on AR was down in November, it was really a very poor month. December was the biggest month we've ever had, so we more than rebounded for the low November. So that's also going to help us next month, which days in AR coming down and cash days going up. This is our profit and loss for November and for year to date. Revenue was $153,000 less than we budgeted. Salaries and benefits were less than budgeted, but materials and services are $115,000 over budget. Year to date, they're over budget $263,000. And I can tell you from studying the detailed P&L, we're over by $100,000 in the fees we're paying for physician services in the emergency department. We are over by $50,000 for temporary labor in the surgery department, which was sort of an unforeseen expense. Pharmacy meds are over by $135,000 because drug costs are up so much this year. We expected a large increase, but we got a far greater increase. Rehab temp labor is $50,000 over budget. However, it did serve its purpose, and the department is doing well, and I think by the end of the year, it's.
And I'd like to say that we have hired permanents now, so the temporary stuff as of April will be gone. And the other big thing is we had two large hits for two one-time placement fees from the contract agencies to get our permanents here. So that will serve us well, and we will no longer be paying temporary.
And their margin should increase as the year goes by. So this all resulted in a net loss for the month of $123,000, whereas we had budgeted for a profit of 12. So we were behind $135,000 for the month. Year to date, we still have a profit of $19,000. It is $41,000 less than we had budgeted for this time. Balance sheet. So, because of the tax deposits and the repaid from Lakeview Gardens, our miscellaneous type receivables went way down, and our cash went up. Our patient AR also went up, not unexpected. Otherwise, no real changes month to month. So, any questions on Lake Health District? So, who's like? Starting with Lakeview Gardens. So Lakeview Gardens continues to see an increasing trend in patient days. It's up again in December. That's a very good news. The good news is the CNA classes were completed and successful. We hired several people, and that gives us the capacity to have more patients, because our lack of staff has been limiting. We're still about 10% behind where we were last year at this time as far as patient days. And Lakeview Gardens, and of course this is when we was part of the district, and this is since it's separated from the district. Our days, obviously our revenue continues to increase since our days of patients is increasing. We're still at a revenue average per month of $147,000 and $169,000 for last year. Our revenue for November was $174,000, so above our average, bringing it up. Year to date is here, and the month of November we had good revenue at 174. We had a profit of 8,994. We've also experienced expensive contract labor in long-term care that's had an impact on our bottom line. It might have been better if it weren't for the temporary CNAs that we had to hire when we were training new ones. So, pretty good. And the balance sheet continues to be very simple, because most of its expenses go through the hospital. It owes the hospital money, so it's not really a whole lot of, doesn't have assets, it doesn't just have a lot of activity.
Keep in mind that temporary staffing has been because even on the hospital side, we have struggled with staffing, getting nurses. We've had some illnesses, and so we've had to use both temporary, and then what's complicated that for long-term care for Lakeview Gardens is that there have been several employees that have been working in long-term in Lakeview Gardens that have gone over to the hospital, which made it more difficult for Lakeview Gardens.
The accounts receivable that you show over there, $788,000. Is that mostly state or what?
No, that's just because when we first started, we had to keep Lakeview Gardens accounts receivable on the CPSI books because we didn't have anything else to keep these receivables, which we know made our auditors very unhappy. We're right now in the process of installing point-click care, so the billing and the AR will be on point-click care. So just to make things simple, I've kept it separate between, so this is how much is sitting on LHD books that will end up going to Lake Health. That's really their receivable. So you could just say this is patient AR. It's patient.
But doesn't the state pay pretty regular?
They do, but we have not been transferring the cash every time you're right. And when we get moved over, it'll be easier, but it is an accounting nightmare, so we're doing it in large chunks. We could do it more often. Down here, this is how much, and this is the main reason why I haven't transferred it either, because really, I do these at the same time to try to make this as clear and simple as possible, because it's just very complicated and we're in transition. So like this month in November, we did $850,000. And still, this is the expenses that Lake Health paid on behalf of Lakeview Gardens. That's the total they owe for that. So, I'm not sure.
I'll get with you. In my mind, once we get this smoothed out, the AR shouldn't be too huge.
No, I wouldn't think it would be much more than $400,000 or $500,000. Yeah. At the most, if we're all happy with Medicare, I agree. It should be no. But this doesn't necessarily reflect what we collected on that AR. It's just what hasn't been moved back in, or it hasn't swapped places. I could probably wipe out, or bring that AR down to whatever the real number is, maybe 300,000, and then also reduce that by the same amount, by the 500,000. That's what I'm doing when I'm closing months. Okay. Any other questions? Okay, and this is the continuation of the roller coaster of Goose Lake Medical Services billing and eClinical Works. This month, we've got a lot of bills going out the door. We now have several different reports. We're looking at, I'm afraid that Juanita and Brian have spent a lot of hours going through hundreds of pages of data to try to make sure that we understand what our revenue is, because different reports are yielding different totals. They're working with eClinical. I think we're getting those numbers closer and closer. I took the lowest number to record as revenue for the month, just to be on the safe side. So, and of course, this doesn't really reflect production of the doctors. The truth be told, they've been going at $55,000, $65,000 a month all year long. This is just reflective of when we're getting the bills out the door.
Also, during the month of November, Dr. Stevens was out for 2 weeks, and Dr. Gilbertson was out for, I think it was 1 week. Possibly, I can't remember, it was 2. One for health reasons and another for, I think it was vacation. So we were down, and we did not have a nurse practitioner because Roseanne Fitzgerald had been our nurse practitioner. She's been up here. We brought in the nurse practitioner in December. In preparation for Tony Reynolds, who will be starting in February or March, depending on as soon as his license comes through.
Okay, so in spite of the ups and downs, the total revenue year to date is $297. Last year it was $282, so we're a little ahead of where we were. Our expenses are really close, and so we have a net gain of $32,000. Last year at $9,600. So we're a little ahead of where we were last year at this time. And Tony is starting. He's been up here to visit to look for homes. He's got a date planned, so we're feeling pretty confident that he'll be coming. The last person I kind of changed their mind at the last minute. Balance sheet, really nothing to report. AR is obviously going up as it didn't go up but as much as I thought it might, so still is way higher than it should be. And I guess the other thing that I don't remember if I told you before is we are still on hold with CAHABA, with Medicare. because we filed one cost report for the year under the name of Stevens Parkview. And Cahaba came back and said, no, we want you to file two. One for the Stevens Parkview portion of the year, one for the Goose Lake Medical portion of the year. And so we did refile that at the end of November, and we're waiting for them to take us off hold so that they will pay us all the money they owe.
So that's about 332,000 or so that they're holding up.
I don't know.
I can get you the exact number.
Yeah,
I just,
it'd have to be something like that,
Yes.
maybe more, yeah.
Okay.
It's a huge number. Okay, so questions on Goose Lake?
How often does the clinic manager go to Alturas?
At least twice a week. Yeah, she's not hesitated, she's spent good time down there and is getting to know the providers, and it seems to be doing really well with them.
Sometimes it's more frequently than that, but the minimum is 2 times. We also have a lot of people from the hospital, so IT will be going down, other staff.
That's it.
That's it, all right, no more questions? Well, rehab report, we got that pretty well covered, or you
Yeah,
want to tell us some more?
We have it pretty well covered. Just to reiterate my mission that to make us as diverse and robust as we can to provide the best care that we can here. So I'd just like to take a minute to publicly thank Cheryl and Charlie for letting me reinvest some of our income into our staff and infrastructure for everything from computers to finding permanent people to help build things up. So it's an exciting time just to be there and to see what we're doing in there right now. The other thing that I'd like to mention, this part of the reason I'm here, I mentioned to Charlie that I'd like to do some marketing, and he asked me to bring that before the board today. So Dr. Gallagher and I have been helping coach the Lakeview Mat Club, and it was my intention that I could, with the Lakeview Rehab Department, could sponsor a tournament here in town. So it's the first tournament that we've held here for a very long time. So Coach Ludwig, which most of you know, is really doing a good job building the program up, and he wanted to do a tournament here. So in order to make that happen, there are a lot of first-time purchases that we need to make with the club. So my intention was to sponsor the tournament to help provide for some of these one-time purchases that they need, and also get some marketing for the department. It would be my inclination to sponsor somewhere between $300 and $500, whatever you guys would feel comfortable out of the rehab budget. So, and we would be community service from age of 5 years old up through middle school. I think we have something like 44 wrestlers that are coming now, so it's a big part of the community.
What areas would you draw from for this tournament?
So for sure, a lot of the Alturas, Thule, Klamath, Burns will probably be here. It's the first time we're going to do this, so it's hard to know who's going to show up. But I'm certain that the California schools will show up. I'm pretty sure that the Klamath Falls schools will show up, and Coach Ludwig has put it on a week that there's not a whole lot else going on as far as tournaments. So in the first year that we've done this, we'll kind of see, but we'll have some pretty good turnout.
There's something I'd like to see us participate in, Chad.
Is that right? You know, we've talked about these things in the past, and Amber, I commend you on what you've done for our hospital. But we are always fearful that if we start supporting outside community projects with public money, that we'll get asked right and left, and it'll get clear out of here.
Right, and I understand that. So you guys can tell me no if you want. In my mind, I view it as marketing because we will have a banner there, much like many other businesses that we will approach, that will, pay an amount to have a banner hung at a score table, which we do a fair amount of work with, high school age athletes within the department. And I respect that view and that opinion, and ultimately it's up to you, so.
Well, mine's in one voice and Gerald's is another one, and we got 3 others here.
Well, Chuck, I guess I would see it too as an economic development tool. I see, and having attended the MODOC tournament, Judy was there, what that does to the community, bringing people in. That was basketball, this is something else, but the census is, you bring in these people, then they spend money in our community. So I think that if you look at it, and I know that we have the potential for having lots of requests, but then we have to weigh them on each merit, and I don't like to see one blanket thing and say, no, we're not going to do that. I'm glad we're able to discuss it, and then we'll just decide on its merits.
I commend you docs for doing that too, Amron. I think it's a great benefit to our community and protection for kids. However, I go back to when we set this policy that we had for these community sponsorship requests, that we would take them all on a one-on-one basis, but that in some manner that needed to meet the mission of our hospital. And the fact that we are public money, I think we need to think about it.
I'm with Judy. We have a policy. We're responsible for public money. Yes, it is a public good to have Mat Club bring people in, but that's more of a chamber of commerce. And I know we all probably here donate to the Chamber of Commerce, and I know that I will be approached in my business to support the Mat Club as well, and I'll have no problem doing it through the business.
I would offer to find you what you need outside of the hospital. Let me know.
I don't think you're going to have problems raising money.
No, and I don't think so either. I just, in my mind, I don't know how supporting a youth club and getting advertisement is any different than buying water bottles to distribute, somewhere else. So that's my opinion on that. And you're right. It's not going to be hard. I mean, I've already approached several different businesses, and everybody's happy to help. I would just like to see Lakeview Rehab advertised and be a part of something that myself and Dr. Gallagher is a part of. That I wouldn't have my feelings hurt at all. You guys told me no. I was asked to bring it before you. So.
How soon do you need the funding?
Oh, the tournament, I can't remember the exact date. We're a month and a half from the tournament. I will personally, all this stuff, I figure we'll need about $900 for just the items that I'll need to purchase to make it work. Flip charts and whistles and garbage cans, because we don't have any of this stuff. And, I don't have a problem, personally purchasing those items myself, and then with raised money reimbursing myself, that's not a problem. So as far as when I need it, it doesn't really matter too much. So
It's the other part that Chuck, I would bring up is that when we have people internally as a part of the program, I think we need to view that as well as this somebody from the outside and help give them that support.
One of the things that I can just comment on, we have worked really well with the school district to try and have, certainly with all the students coming here, we've done a lot to help and work with the school, work together on care for patients. And not just patients, but students, and doing sports. And that as we think about that role, it's good for us to be actively involved in school sports as a public entity. We really do. Our doctors are actively, they have historically given away physicals. They've done as their own business. We probably will continue that same kind of process for the new school, because the physicals start this spring, I think it is, for football and all the different sports. So, as you think about that, keep in mind that the more that we are involved partnering with the school, even if there are some tax dollars that might potentially be used for that, it really does enhance. And maybe we need to think about not just one program, but allotting a certain amount of money for programs.
Not a bad thought, but this would be part of the charity care, charity function of the.
Actually, we call this community benefit.
Community benefit.
And we as a community hospital, as a public hospital, we have a responsibility to provide a fair amount of community benefit. And we do that in a variety of ways. And we keep looking for better ways. If one isn't quite as good as another, we try to look for another. Sometimes, as Amron said, we have provided water bottles. We've provided helmets for kids riding their bicycles. And those are, it's not cheap to do, but that's really in a community benefit. And we certainly put our hospitals and districts' name on that. It's not exactly marketing, but it is to a degree. And so as we are thinking about any kind of activity supporting the youth in a healthy fashion, it is a good thing for us to find ways to partner and to provide community benefit. Now, I'm not saying that we don't just try to pick one or another, but maybe we think about it in a little bit more global fashion so that you can address those requests that come up in a way that you can feel proud that we're using tax money and district money properly. More importantly, district money.
Seems like we're always trying to get the youth to exercise, do all of these things. And here we have an outside group that's helping to facilitate that. I think we should come alongside with it.
It certainly is different because it would be sponsored by the hospital department. That does make a difference. Why don't you give us a definite budget, what you need, Amron, and we can discuss it a little further in our executive session and decide what to do.
Absolutely. You know, with the monies that I've already have promised from other places, I think $300 would be more than enough to cover what we need for the tournament. So, and with that, you know, I think 35 or something will go to vendors to make a banner for it to hang at a table. So, and it's not, to me, 300, 500.
And Amron, it's not the amount of money that's at issue
Right.
here, it's our policy.
And it's not the amount of money to me either.
And I think maybe we need to change our policy. If we're, maybe we should have a long-term community benefit fund that would entertain requests like this from internal sources or, health-related sources. So, okay.
I think we should give Myron a shot in the other knee, and then we have the money. What do you think?
I think I'll give you $100 and you get somebody to come feed for me.
We may
I'd be glad to. I happen to know one of the wrestlers. He's a winner. Stewart Ranches would contribute.
We may have him set up a senior wrestling deal, and you can
There you go.
wrestle for it.
Count me out.
We'll still need lots of volunteers. It's going to take a massive amount of people to make it happen. So anything you can contribute would be great.
All right, thank you. Well, let's move on to the next issue, which is a request for money.
There's another
Bloodmobile.
Only this one isn't junk change like $300.
So I sent out to you the request that I received from the Sky Lakes Medical Center, I also received several requests, the same thing, from the American Red Cross out of Seattle, saying, please, we would consider this. Sky, the bloodmobile that's parked out front right now in its attempt to try and raise, to suck the blood of this community. If I could put it in.
Good job.
Well, and you know, this is really, we all know how vitally important this is. And so as in the letter that I sent you and all the material about that, you can see that Sky Lakes Medical Center has agreed to donate $50,000, and they would be very happy if we would do anything we can to match that. I'm sure that would be within our.
Yeah, this is appropriate, but this bus is 23 years old, which is, you know, almost extinct. And if you took the 50,000 they're talking about, divided by 23, you're talking about what? $2,500, $2,300 a year. They benefit the community way more than that.
Now granted, the bus costs $375,000.
Right. They've already got a lot of other money put together.
It would be my recommendation that you consider making a donation, we, the district, and I would suggest that we consider something in the nature of $5,000. We have not budgeted this. I just received this, as you can see, a month ago. But it is a vital service to our community, and we are about service to our community, and want to have it continue. That would be my suggestion. But we haven't talked about it, so I wanted to bring this to you.
I would also point out that Sky Lakes will give $100 for every donation from Lakeview of blood between January 1st and March 31st. So if you go give blood, Sky Lakes will give another $100 toward the. So Carol's given $100. I've given $100. I don't know about the rest, but.
It's an excellent point that we ought to make sure that the public knows about their willingness to match Lakeview donations. But that's a great thing.
So when, how long?
From January 1st to March 31st. This is what the nurse there told me.
It says in the letter they have 200,000 raised. 375 dropped to raise.
Well, I think Charlie's thought is low. I think we should get more than 5,000.
Where would that then come from?
We have the cash to do that. It would come as, we would treat that as a community benefit donation or payment. But we do have the cash to do that.
How many pints of blood do we utilize in the district?
It's a good question. I can't tell you off the top of my head. You know, the truth is, it really matters when we have a terrible accident. And a couple of years ago, several years ago, you may remember, where the community really got together to donate blood because it was a terrible accident and that person needed a lot of blood. So we hope that we don't have to use a lot of blood, but when we do, it's vital.
That's the source it all comes from, basically.
Well, when we make our donations, it gets used right then and there, it doesn't sit around. But somebody else needed it, just like terrible accidents occur. So that's the nature of how the Red Cross works.
I think it's already.
You do, okay. Jane, let's have an auction. What's your thoughts, Judy?
My thought would be that I think it's a good, donation
How much?
to support the equipment, yeah.
How much?
Well, is $10,000 too high? Maybe we have the money to do that.
We have the money. You know, whenever we spend money, we want to spend it as wisely as we can. We have been very, you as a board and the organization has been prudent with cash over the years. We don't want to be carried away. But again, this is such a vital service. Oftentimes I think of this as if a piece of equipment were to break, we would fix it. And we have the ability to do that. This piece of equipment is on the verge of breaking. It's vital to us. If $10,000 was a number that you felt more appropriate, I would agree with that. It is really important.
Is this Medicare reimbursable? Okay, I have no problem with 10,000.
Any further thoughts, Tara? Somebody care to make a motion?
I'll make a motion that we donate $10,000.
Jane makes a motion for $10,000. Do I hear a second?
I'll second that.
John seconded. Those in favor?
Aye.
Aye.
Thank you very much. I know that they'll be very pleased.
That's like $500 a year, 20 years.
I didn't ask if Amaranth's was Medicare reimbursable.
It probably is.
Oh.
All right, medical staff report. Charlie, I guess you can medical.
Do I have that? Actually, we have, pardon me? No, I know.
Oh, okay, that's all we have for that.
We approved, well,
That
just,
will be presented for next board meeting, because we didn't get them sent out to the board.
okay. So the only thing that I can report, unfortunately, Dr. Graham was not able to be here. He's on call today and it's been very busy. The medical staff met this afternoon and we will bring to you the changes in the applications for renewals or new applications for their credentialing information. I can tell you that they, as they always do at the first medical staff meeting in January, is to elect officers. And for this year, Dr. Steve Hussey will be the president of the medical staff. Dr. Tim Gallagher will be the secretary, and Dr. Scott Graham will be the treasurer for this coming year.
So, Dr. Hussey is chief of staff.
He is the chief of staff, or president of the medical staff. So he's the chief of staff. Other than that, well, you all were at the, or many of you were at the joint conference meeting last month in December. Most of the issues are moving along fine.
Okay. Nursing report.
Unfortunately, Teresa's not here, and I get to give her a report. She is actually at a conference in Portland with NAM, patient P4P, Patient Family Participation Conference. And so there are a couple things that we wanted to talk about. Specifically, we have a couple policies that she would like, we would like to have you consider. I believe we have sent these out to you. The first one is the tobacco-free campus policy. And we'll start off with that. As of, as you all have seen our tobacco-free policy, it is widely expected that throughout all hospitals in Oregon that we are a tobacco-free campus. All hospitals are, and as of January 1, it has become a state law that you cannot use an electronic cigarette in any public building, including the hospital. So we have been working very hard to make this a smoke-free campus, and you'll see signs out front of every entrance. We have signs posted frequently throughout the hospital. But we would like to have your approval, the chief of the medical staff has agreed to this, as well as I have, that we continue to be a smoke-free campus and an electronic cigarette campus that are tobacco-free. We don't encourage chewing, so if anybody does that, please take it elsewhere.
What's that policy number?
The policy number is 230019.
I would ask for a motion. Approve the policy.
So moved.
So second.
Move from second, those in favor?
Aye.
Aye. Thank you.
It is a difficult policy to continue to maintain, and that's largely because sometimes physicians struggle with patients that wouldn't come to the hospital if they aren't allowed to smoke, and they wrestle with that problem. But we want to take care of our patients and help them with that condition. We also have the emergency prescriptive services documentation and the patient safety and observation policies. I believe you've all seen them. They're pretty straightforward. Do you have any questions about those or issues? I would recommend that you approve those.
So moved.
I'll second.
Move from second, those in favor?
Aye.
Aye.
Thank you very much. Nursing also holds an annual meeting in December to talk about the goals they've accomplished and goals they're working on for the coming year. They've done a lot of really good things. I think you've heard Teresa talk about the adoption of bedside reporting through the assistance of Don. That has really been improving our scores, our patient safety culture program that is working well. They're going to be asking for more lifts, so we'll see that in patient rooms. If you recall, those are the lifts that we put in the ceiling to help move patients. That dramatically helps or reduces the number of not just accidents with patients, but back injuries to staff. And that is a very, very important part of patient safety that the caregivers carry. T-system installation has been working along. The meaningful use, stage 2, we met that. I believe I told you this. We're very proud of that. If you're, just as a reminder, when it's part of the Affordable Care, when we got money to get our CPSI system, we had to actually use the computer system. It was one of the requirements of getting the money. There was 7 stages. We met meaningful use in stage 1. In prior years, we worked to meet meaningful use stage 2, which we now have met. We struggled with that for the last 2 years because that's the part that really takes a lot of the physician time. But our doctors have been, it's a struggle to get through that, but we met. So that's a great accomplishment and done a lot with our nursing. Our KCC program, we're going to take a break in a little bit. We're going to go see what is happening to our education. But from a nursing-wise standpoint, they've been very involved with that also.
Is that helping our nursing shortage? Well,
This is pennies in the bank, as they say. We are the RN program. This year is the transition period, so those nurses that got their LPN, so their LPN can transition to an RN, so they're in that class now. In September, they will start. Those that have met all the criteria to get into the nursing program, they will start. That will be part of the classroom will be done here. It's a synchronous class, just like we have at the Innovation and Learning Center at the high school, or Daily Middle School. So those are the things that nursing is very proud of, that they're working. Any questions that I could answer maybe on Teresa's behalf?
How's the acute census been?
continues to wax and wane. Lately, it's been fairly robust. God bless you.
Thank you. Sure, now, you want to tell us your employee who's recognizing?
You know, we have, it's always fun to find somebody that we're proud of. This person has always been involved in helping employees volunteer to do things for employees in our Christmas parties, our picnics, our events. And a lot of those times, it's to help celebrate and help build team building. But it also helps raise money for our emergency fund. We have an emergency fund for cancer problems. We have an emergency fund should somebody have an unexpected emergency, and we give them money if they have to drive someplace or take somebody someplace. So this person has always been involved in that. She now serves on the Senior Center Board of Directors and has been a very active supporter of our seniors. Provides social services a great deal on our Lakeview Gardens, has been constantly looking for ways to improve the services we deliver, and most recently was involved in helping one of our employees who had very difficult news, help that person through the process and help get the care that they need. This is Sheree Morgan in Lakeview Gardens.
Thank you. And your CEO report.
First thing I'd like to read to you, I just got today, so you didn't get this in the mail, notes and thank yous. Humbling is all I can say, along with a big thank you to all who are responsible for the Health Services Award. I am fortunate to live in Lakeview, to be surrounded by so many people who contribute to what makes this such a great place to live. My greatest reward is to have been able to see so many of our youth grow and contribute to society. The saying that it takes a village to raise a child is so true, and all of you contribute to their success. Additionally, you are all pretty tricky. Sincerely, Bobby Stinch. Those of you that weren't at the Chamber Gala, she did win the award, and apparently the way she was advised that she would get there is that, as I understood it, I thought it was a different story, but what Lisa Cahill said was, I'm supposed to receive an award, but since I can't be there, could you go there on my behalf? And so Bobby was there, and then she said, wait, but you're here. Anyway, that was a very nice thing for her to write. We've talked in the past, and I brought to you times when we need to declare items surplus. And I asked Jim, why it is that I have to bring that to the board? Why can't I do that? And what he explained to me is the County Board of Supervisors has designated this board, you, as the arbitrator of all items to be determined as surplus. Did I say it wrong?
Yes. You're the contract review board for the district.
Excuse me.
The commissioners are the fallback contract review board.
Contract review board, I said it wrong. So, what we are going to be doing is rather than have items build up in a warehouse and wait for years and years and years before we declare things surplus, we're going to try and start bringing those a little bit more frequently to you, because there's no sense storing. We have a couple of items that we'd like to have declared surplus. One is an incubator model 3000. It's well over 20 years old, and we can't even find out what we paid to buy it. We have a Striker infant warmer that's well over 20 years old. It was actually wooden, and Mr. Stewart may have been purchased about the time that you were in the other hospital, I'm not sure. And we have a Coremetrics field monitor that was purchased a long time ago, over 20 years. All have been replaced. All the equipment is obsolete, And if I showed you the pictures of them, you would agree that these ought not to be used in a modern hospital. I would ask that you would declare these. We will try to provide you with some information in the future. If that's okay with you. I don't know if you need a lot of detail.
You need a motion.
I believe I need a motion.
A question,
Yes, ma'am.
who in the world will ever use those? Not that we don't need to surplus them, but who would use those?
We could sell them to the 42nd group, the incubator and the warmer.
You know, I think that at times we have taken some equipment and have made arrangements to provide it to aid organizations that want to take them to foreign countries. I think some of this equipment, they would reject. So,
But then that gives you the ability to dispose of it once it's surplus.
once it's
right?
been determined
It'll go away.
surplus, it can go in the dumpster.
Oh, okay. Well, I also move that we surplus an incubator, an infant warmer, and a fetal monitor.
Thank you. Some of the items we may be able to give to some, as a donation to some organization. Many of them, no. It's kind of like, thank you. It's kind of like a lot of our computers. You can't give them away, except for boat anchors. But they are still equipment that is owned by the district.
Those in favor?
Aye.
Thank you.
Thank you, Charlie. You can give them the cedar wheel if you want to.
I'll let that one go. We had the first of 2 inspections from OSHA. We actually have invited them here so that they could help us. The first one that was today was for safety and, health, and no, it's safety this time, and then in a couple of weeks we will have the health and ergonomics part of OSHA. They're here to help us find areas that should an OSHA inspection come through, and we could be inspected by OSHA at any time. We could make changes in advance. Apparently, once they come here, for the next 60 days, should OSHA provide anything that they find, we would not be liable to be fined for not having fixed. But we do want to ensure we have a safe environment, so we're inviting them to come. We have a problem in our kitchen. We are working on fixing that. The roof with the snow has caused the leaking, so we're working on fixing that. We can't fix it until we have less snow. When I talked a little bit about the work that the nursing staff is doing with our computers and our meaningful use, I'm pleased to say that Dr. Gallagher has now gone to CPOE 5 as of January 6th, and that Drs. Graham and Cahill will be going live later on this week. This is really a big step forward. We've been running 2 CPOE 4 and CPOE 5. CPOE 5 is the most current. But we held off with making lots and lots of changes for the doctors to help get them as comfortable as we can. So we're making steps forward every day. And this is a very positive thing, I think, for all of us. We received a check from the Partnership for Patients, where Teresa and I are right now, in the amount of $1,500 from the Oregon Association of Hospitals. That will be used toward that. Don is serving as a board member representative. So that will be used to help us keep track of a lot of our clinical information. So it's nice to get monies like that. Yesterday, Judy and I went to a joint powers agreement board meeting. Do you want to say anything about that, or would you like me to comment?
Well, surely, Charlie, you can come give a better detailed report than I, but I would like to say to the board that after 4 meetings now, something like that, I am seeing some encouraging comments and engagement, if you will, of the other hospitals in trying to move forward, especially with physician recruitment at the top of their list, and trying to work together to do something that's beneficial for all of us.
We talked about several things, one of which is the CNA program. We, as you recall, last summer we were going to work with KCC to get that, and that didn't quite work. So we now have our CNA program. Alturas, Modoc Medical Center, is in a situation where they will not be able to continue doing the next couple of years, keep doing that CNA class. So we're now going to be jointly having some of the CNA applicants taking our CNA class here, getting their Oregon license, and then transferring to get a California license. This is a great way that will help reduce our cost of having the class, as well as helping their members of their community take this important CNA class. That's a great way of working together for us. We're working on getting some more information about doing outpatient market analysis, looking at where patients are going and seeing if we can meet some of the needs. And if there's opportunities for us to help in that area, as those hospitals are, all of us are looking at them. As Judy said, we are actively working on physician recruitment and retention for all of our communities. And that's, I think, a very positive thing. If you recall, we had a physician recruiter that we had employed to help to work for us. We weren't able to find candidates that we could actually sign up, but we're still actively looking, and now we're working a little bit more together. We're also looking at a shared compliance program using Patty Baker as a resource and some of the resources from Modoc Medical Center. At this point, Mayors doesn't have their person left, and they're without, and Cedarville doesn't have a person. So we're looking to do some sort of joint working together to share and have everyone benefit from that. So, and last but not least, we're working on our community health assessment. We did a CHIP program 3 years ago, and then this is continuing on. All critical access hospitals, actually all hospitals, are required to do a community health assessment as a new condition of participation with Medicare. Here, Norris, who is our CHIP coordinator, will be doing that, and we're starting that right now. Should be completed in a couple of months. And the other hospitals are interested in possibly sharing that service with us. So again, a lot of good collaborative discussion. And I think you're right that it is been a long slog, but I think we're making progress. Any questions about that? I want to repeat myself because we talked a little bit about this at our planning session, which I thought was a very good session on Tuesday. Just want to reiterate that the Oregon Health Authority and Oregon Hospital Association partnership, with which I'm on the committee, we met on Monday to talk about, on the telephone, and it will be going before a legislature for possible options, asking the legislature for monies at the next session, which starts shortly. And we're looking at 4 possible areas for assisting rural hospitals. The first is a transitional post-acute care program. It's a very aggressive program working with Mayo Clinic as the contractor that would be helping us in that process. We'll see how, if the monies get allocated from the legislature, we would be very interested in that, and our physicians continue to be interested in discussing this. The second thing is the Oregon GRE Consortium, or the attempt to bring more residents and residencies to have rotations out here in more rural settings. So hopefully that will work. Then an expansion of population health, and lastly, the virtual clinics that we talked a little bit about, where those communities that don't have urgent care after hours or don't necessarily have an emergency room, they could come in and sit in a kiosk with a computer and sort of like Skype and able to have contact with the practitioner. So that is actively going on. I'll let you know as we go. Do you have any questions about anything else we can talk about?
I have a question. Did we get any response from the auditor?
I talked to the
Did you
auditor,
talk to them, Chuck?
I did, and he was waiting for some material to come back. And I understood, I got another email back from him that he got the questions answered that he asked for. And then from that point, I don't know where we're at, but it should be getting there.
It does appear to be getting there. He continues to ask questions and, I told him it's very important to me to get it done by January 31st. He said he thought he could do that, so
By January when, Cheryl?
31st.
Okay.
We've been very frustrated.
Sooner would be better.
Did it sound like they could get that done, Chuck, when you talked to
He
them?
didn't give me an estimate, he said that he would get to work on it today, I guess, was the day. The day
And I
after.
know he was working on it today.
Right. And he said he still has the Lakeview Gardens to do. So, he's still got work to do.
I want to make sure everyone knows we have this is the shortened version of the Lakeview Gardens design plan. We'll have the larger copies in the next day or so. But anyone would like to see this, it's available both in my office and Melinda has a copy. So Daryl Anderson, of course, has a copy. But this will be submitted to the town and then through all the various agencies. It's also been put out to them. So we'll have as much information about that as we can.
When do you expect this to come back?
They should be back within the 30-day time period. So we're about February 4th, as of the last that but I'm not sure if the date has changed.
Anything else?
If you don't have any other thing, maybe we could do a little field trip. We'll take a look
Do
at
it
it.
during our break, that's all right.
If that would be fine, sure.
Do we have any executive session items tonight?
I don't.
You know?
Be still on my heart.
Well, if that's the case, then we can probably just adjourn and show your.
Where's you gonna do that camera?
Well, yeah, okay, we'll come back in executive session.
Sorry.
Go back in regular session, just finish up what we started to talk about on Amron's request, but even more so on our policies that we need to have. And I would comment one thing in our discussions we had, getting the doctor to go to work for us. One of the requests was that we do more community support that they had done themselves. So I just put that thought out too.
I hear you have a doctor directly involved in the
Yes.
program, Chuck.
Yeah, and he's one of the ones that really has been involved with community.
But he's not the first doctor that's only been involved in community. They all have.
Oh, absolutely.
I mean, every one of them coaches, they donate to hours, money, but they haven't come to us to ask us for a request.
Right.
Maybe we should reread that policy.
I think we need to revisit it. Yeah.
Is that?
We'll bring that out to you, we'll get it to you, and then let's have a more conversation.
Because,
Yeah.
we have had people come to us, individually, with the board entertain a donation to, the soccer kids or to the ski team or to the, and I've been, as Judy has as well, saying, no, we don't do those things because we'll be nickel dime forever and ever. So that's what the policy was about. It has to be more directly related to the hospital itself.
Now, Amron's position was he wanted to make his department a sponsor, as I understood it, which is a little different position. We do
You're coming at
sponsor,
it from the marketing concept as well, Chuck.
we do sponsor the health fair and some of those things.
I was a little surprised at his initial contact the comment being made, if I heard him correctly, about using some of the money they have made in the rehab department to put back into the community, something like that. I thought that was not necessary.
No, and he may have misspoke. I don't think that's ever been the intent. Because I know in my conversations with him, he has not ever perceived that as, if I make money, therefore I should get some. Yeah. So I think that he must have just misspoke. But we have talked, and we have tried for years to be as supportive as we can to the efforts of Bobby Stininger. And we do send our physical therapists there. Bobby has been a very strong supporter of the program and has not been terribly willing to have other involvement. There's been other training efforts that we've tried over years to bring to the school to help improve the safety of the kids.
We supported the reader board.
We did. And so I think that,
We struggled with this once before, a couple of years ago.
Yeah, we did.
You don't have that
About the time we did the
policy where you can just grab it off the computer.
I guess it should be in our book or binder.
Didn't we
Yeah, let me go grab the
develop a
binder.
policy just around the time of the read board issue?
we did. And we talked about this, and I should have brought the policy, sorry, we're getting there.
Emron pretty much got his money tonight.
Oh.
Not as a board.
He'll get his money when we're done.
Well,
You know, it's not the amount of money,
it
$300
isn't the amount of
is
money.
No.
It's
nothing.
the position of the organization.
It is.
And that's really the principle. And that's why whenever people ask me, I say, we have to be very sensitive to this. Because I get lots and lots of people asking me for things, sure.
Well, I get a lot of community people asking if the hospital would sponsor something.
So,
It's on mission.
But it just throws a whole different twist on when you hand your department heads and your doctors involved in something. And who, you should be able to go to your own organization first. If they're not gonna support you, why?
Well,
That would be the first place I would go. They go, okay,
one of the things that we were concerned about when that discussion came up is any donation or any allocation of money needs to come from this group. It can't come from somebody else driving it, even one of the physicians, no matter how well-meaning they are. You are the ones that are directing me how we give any money if we do that. So that was more of that concern. But we need to be clear how we support the health of the community.
What is our budgeted figure for community benefit or community charity, whatever the term is we have?
It's a variable number.
Is it?
Part of what goes into our community benefit is the amount of money, a large part of it, is the cost that it takes to maintain the long-term care facility. Because that historically has not met all of it, the revenue hasn't exceeded it. So our policy is, as a taxing entity, is the responsibility of Lake Health District to be judicious in the management of public monies. We will consider support of local organizations through cash donations, in-kind service, or volunteer activities only when a request falls within the parameters of the goals and objectives as stated in the Lake Health District bylaws and mission statement. This donation policy ensures that all donations, in-kind service, and volunteer activities are aligned with our social responsibility strategy, maximize opportunity for Lake Health District visibility, and are within budget and resource limitations.
That really helped.
Congress write that, Charlie?
We wrote that.
I thought you penned that.
Yeah, you were right there, you were with us when we did it.
I know, but that's,
Yeah.
which means we can do
Pretty much what you
pretty much what we want.
But the reason for that is because there are times that it is appropriate.
Yeah, I understand that.
And maybe one of the things that we ought to think about is having a set amount of money. And then have that available for donations that support the mission and service of our hospital.
Well, and he stated as marketing, you know, we could do it in an advertising budget. So what I write it off through in my business, I mean,
Advertising is without,
they make a little banner and put it up and there's like the hospital.
absolutely.
The only problem I have with that banner, it says this is sponsored by Lakeview Health District, is everybody's gonna say sponsored by Lakeview Health District. Maybe they'll sponsor my project.
Well, of course,
Yeah.
that's absolutely correct.
I mean,
Of course.
we have this, but maybe one of the things that we think about is, rather than just being a sponsor, that we're involved, and whether it's the rodeo, and we provide some kind of support for people that get hurt, injured. And we do say, part of the money that we are gonna put up, or whatever we're gonna do, is specifically that meets within our mission, caring for our community. Jane, you have a problem with that?
Well, I'm just trying to think how that would work, like we provide free stitches or.
No, I don't mean free, no. I was thinking,
Providing support for the ambulance service.
I was wondering about maybe having some kind of a form or something that we have people that are asking us to sponsor them fill out, and that and have them tie it to our mission, so that when requests come to us, then we can, so that we're not trying to tie it to the mission, we're looking at.
we're probably gonna, our mission is fairly broad.
Right, but.
And so our vision, we're gonna be working on expanding on our vision statement to help with that, to help bring some of that together. But the truth is, our responsibility is not just sick people, but also it's becoming more and more population health.
Right, I'm just trying to say that, we're going to be having requests, fairly often.
As soon as we open it up.
As soon as we open it up, we're going to be having these, so at least have somebody else do the work of trying to tie it to our mission and our vision and all that. Because otherwise, we're going to be sitting here at every meeting trying to decide, how does this.
But I disagree with that. I would like to see, okay, here's what I want the money for, then let us do that. I don't want to see a big long form for somebody to have to fill out for the rest of the year. I want to keep it simple, yeah, so that we know, okay, I want this dollar amount, here's what I'm going to use it for.
Well,
We can
why
make
come
it
to
fit.
us? I mean, why, at least have them tell you why come to us.
So,
I think the difference here is that we have 2 employees personally involved.
Big difference.
That is a big difference.
And I hate the idea that we, so far anyway, have said no. I do. Because I would very much like to support that, because I'm all about community programs, all about young kids getting involved in activities and getting off the couch and out of the potato chip sack. But if you even considering that comment, Chuck, open it up to hospital employees. We have 200 hospital employees and other unemployed medical providers in this community that have all sorts of community involvement and need for what they do.
well, maybe you could think about having a total limit and a per donation limit.
That still begs the question.
Well, the other way of going at it is you assign Charlie $10,000 that he can use throughout the year, and his discretion for this type of thing, and that's just our community budget.
That's what the doctors wanted to do.
Yes.
You know, for me, the difficult thing when you put a limit on that, I mean, you may have to put a limit on it, whether you approve it or whether you disapprove it, but for me, then it's almost like first come, first serve. And so you get what you think is a real important need in January for whatever amount of money, and then in September, something comes along that's really a need, and we're out of money.
I think maybe then,
So
if you,
how do you justify that?
so then what we would do is, like with a budget, is you would say, Charlie, manage that, make sure you don't run out at the end of the year. And I do quarterly.
So that's where Charlie would come back to the board saying, we're out of money, do you want to replenish this fund?
And it'll take some history there,
It takes some
so that you kind of feel out a few years.
And there's gonna be a lot of organizations that we don't necessarily think about.
And
But at the same time, it does help us be more known. You know, you could probably rattle off 20 groups right now that are exercise or physically, some sort of physicality. Whether it's high school sports, elementary sports, adult sports, adult activity.
See, the Rotary Club just approved a project for the swings and things over at the AD Hayes School. So maybe if the Rotary Club came and said, hey, would you guys, match us, we're putting up 15,000, why don't you match us?
Oh, and they're wanting to put a whole new pavement, concrete.
But I think that those
But
are the
anyway,
kind of,
I'm just throwing that out as,
Well,
I'm not sure that those are the kind of things that we would want to be involved in. I would think that we would want to
but that
focus,
benefits, Charlie, that benefits every child in Fremont Hayes School.
that's true. But
You have another
that's-
taxing entity that can do that.
But then at the same time, that's buying bricks and mortar or something to that effect. If you're helping to, it is a can of worms. There isn't an easy answer.
You know, you guys, we have this discussion. We have this discussion at the point where we developed a policy because, I'm really all about the absence of a policy gives you the authority, in my opinion anyway, to make a decision on the spot. But when you have a policy, then you need to follow it, unless there's a back door out through it. Is there a back door through that?
So we can allocate and follow the policy, right?
Allocate, what's that mean
Okay,
to you? I mean, what are you saying? Allocate what?
300, we could say yes, 300, 500, and we're following the policy for
Because,
this.
because that meets
Our policy.
it does meet our policy?
What the policy says is, will consider support of local organizations who cash donations, in-kind services. When a request falls within the parameters of the goals and objectives as stated in the Lakeview District bylaws and mission statement.
So,
Our mission statement says to care and provide for our community.
So you got all
say
these,
501c3 organization, anywhere in there?
It says, contributions will be made only to a qualifying nonprofit agency. Contributions will not be made to organizations conducting fundraising, third-party giving, on behalf of nonprofit agencies. Requests from religious organizations for sectarian purposes will not be considered. However, community programs sponsored by a religious organization will be considered, such as healthy eating class.
but what we tried to do in all of those statements is to tie that to a health reason. Correct?
Yes, that is our mission.
Is the
what's healthier than having 40 kids out wrestling with each other? I mean, these are the kids that are wanting to burn off some energy, do some things. A lot of, if you look at sports in general, those that fall in that category often are the marginal ones that struggle in social areas. But with the wrestling program and that,
You mentioned the other taxing entity, is the high school or the Lake District 7 sponsoring the Mat Club? Does the money go through the high school coffers and all?
No,
Totally separate.
totally independent.
But
40,
the same thing holds true for the basketball team, the baseball team, swimming team.
No,
No, those are,
they're all school sponsored.
Those are school sponsored.
not swim team.
So swim club,
swim club isn't through the school.
okay, so that would be an eligible,
Pop Warner football, AYSO soccer, none of those are through the school.
Right.
Well, there was some reason for this policy, and I think we really probably are better off to stay with it myself. I'll give them the $300, that's,
Oh,
Yeah.
I've already I'm gonna give you money too.
Yeah, we've already told them we're gonna give them money.
Already money, yeah.
But I still think we're missing the point, Chuck, by not telling our department heads, our doctors, our community, that yes, we're out to assist and be a part. I think that's a great opportunity for us to say, okay, we want to be involved in the community.
Chuck, what did we end up doing with, Hussey and Gallagher's request for community donations? Cause I
we
remember that.
we didn't give
You
it to them.
didn't write that in.
Yeah, we didn't write that in the contract, they asked for it, as I
They did
recall.
ask for it, as I recall too. But they-
Gerald just gave us an idea though, if you would, if we have department heads directly involved, or doctors, or providers, then you could make that exception in our policy, if we want to change our policy.
See, I don't see that we're making an exception, Chuck, that's where,
Well, we're not, you're not providing health needs, in my mind, that's, I think it's, yeah,
That's a tough one, but it is a community benefit.
it's a
and that's-
community benefit.
That's something that we have to be concerned about in our budget. All $300 doesn't make any community benefit, we do. Because we need to be demonstrating.
Did that say they had to be nonprofit or something like that?
yes.
Absolutely.
Well, they're nonprofit, aren't they? I'm sure they're not.
I'm sure he's nonprofit, but I'm sure he hasn't applied to the IRS or done any of those things, but it looks like a nonprofit, walks like a nonprofit.
and that's why I think we didn't put in 501c3, because there's a lot of small organizations
Right.
that are nonprofit, and that you don't wanna beat them up.
The simple thing for the hospital, we don't, we're not worried about trying to deduct a contribution to the Mat Club. As an individual, through my business, I can say, yeah, put a banner out there and I'm advertising. You, on the other hand, it's not a 501c3 organization, you can't deduct that.
Mine's a donation.
Just a donation.
Yeah.
And that's just part of our community. But, well, it's a tough one to struggle with, isn't it?
Well, we could, I guess if you,
I don't know, how does the town of Lakeview handle it? How does the Lake County Commissioners, how do they handle it?
as the town of Lakeview, they do,
Well, here we have a commissioner, so
they don't change.
They didn't, when I was there, we didn't.
And I don't think the town of Lakeview ever donates anything, do they?
So, as a public organization, I think we're in the same boat as those.
See, and I can't remember in the school, when the years I was in the district, we ever just donated money to anything. They can use our facilities, they can use our equipment, they can,
Well, like the Mat Club is probably using their equipment.
they are.
Yeah.
Well, I can tell you that I struggle with advertising. I want to have the name of the district available to the community. And I want to do, and I don't want to just support a couple of media outlets, newspapers, radio. I'd like to be able to do more. But I also certainly understand the policy, and so we haven't done any donations. But it is, I think, very important for us to support things that are healthy, encourage people to be healthy. And I don't have a clear answer of what is the best way to do it. If we were a community hospital, it would be a completely different situation.
I would love to be able to support that club as a hospital. I would love to be able to see the hospital support some of the community needs as a hospital, but I'm concerned about our policy and I'm concerned about the tax dollar.
I frankly am always disappointed we don't see Lakeview District out when I look at the rodeo. I see all the banners go by.
I'd like to see you do that. See us do that.
But I
We don't even ask Charlie.
understand. But I
Also,
also,
the Klamath Rodeo, do you see Sky Lakes banner running around out there?
I've not been to Sky Lakes, but I tell you, you see Sky Lakes everywhere else. I don't know where all they throw their money, but they throw a lot of money around.
I've been to a lot of Central Oregon rodeos and I don't see a St. Charles
Oh, you
banner
don't?
anywhere.
So then,
But I mean, that doesn't mean anything, but.
They did actually, as a matter, when we were in Klamath Falls, Skylakes did have a banner, in the gym for the wrestling tournament. It just, cause we were like, okay. They do have something on there, I don't know what they did, but I would assume it's some sort of advertising or something, so.
What do you think,
Over there?
I think you're in danger spawn.
You think what?
I think you're in danger spawn. If you go away from your policy, you open the door to all sorts of abuse. At the same time, I think the marketing, you should call it marketing, that's good now.
so how, it would be okay for us to do marketing, but not to do donations.
Correct.
Right.
Of course, I accomplished the same thing, just call it a different thing.
Well, in the banner, you just put,
You could advertise it.
That's something
That was
for,
the difference that I was pointing out.
That's right.
to show that we have doctors who'll fix you after you get hurt.
We can,
We have an ad, as a matter of fact, that's similar to that for sports preview for rehab, so.
we can, there are ways to market. So if you're okay with that, we can do marketing.
That solves a lot of little problems, you know, people asking for donations as opposed to somebody coming to you and saying, hey, we can.
Would you be willing to have your marketing, advertising dollars or marketing dollars? We can accomplish that. It's not a donation.
No, right. But these amounts are small enough that it's not gonna make a big difference to community benefit.
No. But it still does exactly what community benefit is designed to do, and that is to support our community and to promote the services of the district, that the district offers.
So that, in this case, Amron could put an ad in the paper.
Well,
No,
I'm not sure that
that would advertise the Lakeview Mat Club tournament sponsored by.
No, we
Well, we would be a sponsor.
I'm not sure I would do advertising of their event. But we could have,
Okay,
we could help them with,
But if we put up our banner, they agree to, okay, let us put up our banner, and it doesn't have to be, say, sponsored by.
Right.
But we was
Like Health
okay,
District.
if you do that for $100, we'll give you $100 if you allow our banner there for 2 days. Then we're good, right?
and our banner would say, Lake Health District, here to support you when you are in need.
Yeah.
Something to that effect. Or something that says,
do we have a banner like that, or do we have to make a banner?
oh,
Daryl Bender could make one.
Yes,
We can make
around $30.
Banners are easy to do, and you can create them for different sizes and different opportunities.
We could have a closet full of them so that when somebody came by, we could.
We could do that.
You could put one up in that schoolroom so that everybody in Klamath Falls would see it.
So that's all I'm mindful, I'm good with that.
All right, let's leave it up to Charlie's discretion for marketing. He takes care of that.
Let us know what you do. Or not. Keep us aware. I want to know.
No question about that. I mean, we're not trying to go willy-nilly.
No, no,
We're not sponsoring,
no.
we're marketing.
Okay. Now, before are you ready to adjourn? Almost.
No, I'm ready for anything you want.
Okay, the issue with Myron, could you explain what's going on there? Why is $200 more for the same thing now that it's the hospital versus the clinic?
Please keep in mind that I didn't come prepared with his medical information because that's HIPAA.
Talking generalities, I don't care.
So, one of the things that we do when we look at all billing is we employ a firm that come in and look at our charge master. And every year, we've been doing this since I've been here. And they survey other hospitals. We don't always survey other clinics. We have not done that in the past because frankly, we didn't have another clinic. And we check our pricing against other organizations. And we check our pricing against Medford, Bend, Klamath Falls, Reading, Eugene, to make sure that our prices are consistent with others. We look at also at Burns. We're now going to be looking at what they're charging south of the border too. When it comes to clinic service, we try to compare what you would get if you went to a physician in another community. And we have that. We're doing that. Some of what our pricing is based on what we know for outpatient facilities, not necessarily clinics. So we have some learning to do. And if we have set our prices that are higher because some clinics provide much lower service, they charge less. It's not uncommon for clinics to charge less than what the market is. So, it is.
Did we change charge master for we're using?
We added some things, we changed some things, not a lot, but we did make some changes. In some cases, we made mistakes. I don't know the answer. So this was the first time that I heard, well, no, I heard about it.
Could this relate also to the ICD-9, ICD-10 changes?
Probably not.
Probably not.
Probably had everything to do with just how we, and sometimes we do charge more than we should. And when patients
But there was a difference between the first shot, what, 3 months ago or?
The difference was when the clinic was privately owned and then after the hospital took over.
Oh,
See,
okay.
then it was a $200 increase.
Oh,
When he asked them, that was the answer that they gave him.
and
Because now the hospital owns it, they have changed the amount. The fee.
And one of the things that happens a lot of times is in private business position, people discount in different ways for that service. But as a hospital, if we charge for the injection, we charge for the medicine, we charge for use of the drug, which is pretty standard, impacts the bill. We have to remember that we are a small community and we have to be sensitive to that. Sometimes we're not as sensitive as we should.
Yeah, I know the doctors didn't always charge the full rate either to some of their customers. That was a personal.
But you have the thing, of course, in Myron's thought pattern is, if private industry can do it and make a profit, I'm paying taxes to you, why can't you do it even for less?
Well, here's the answer to that. And this is also true in all pricing. You may price one thing below one area, but in another area you charge significantly more. And at the end, it balances out. I don't know how the physicians did their pricing, but we can certainly look at it. We try to be as appropriate as we can, but also competitive.
Did we change the office call rate? The fee for
To walk in the door?
walk in the door? Yeah.
No, we didn't change that. To my knowledge, no. We kept that the same.
So if I go to Scott, I may get one price, and go to the clinic, I get another.
That's always been the case. And if Dr. Graham elected to raise his prices, if you didn't go to the clinic, you wouldn't know. If you were a shopper and went from one doctor to another doctor, you would possibly know. Or you told somebody else, guess what? This is what he charged. But the clinics have always tried to be close to what the other. But they also don't engage in price fixing, which is setting prices to guarantee that they're the same. That's restraining trade.
So it'd be interesting next board meeting if you do happen to find out why, let us know. Why there was a difference.
Because we charge, probably because, well, I have the specific
It's
answers.
specific, yeah. Okay.
Have there been more situations like this, Charlie?
This was the first that I was aware of.
First.
There have been other people that have had some concerns, but this is the first that I heard of someone saying, I think that you're charging a lot.
I got a letter,
Pardon me?
I got a letter from a friend that complained about us charging a lot for an office visit. It's been resolved, what have you,
But relatively speaking,
it's common that people get upset when they get a bill.
but we don't have a lot of complaints. We have a department, the business office does deal with that. So the fact that it doesn't come to my attention doesn't mean it doesn't occur.
Yeah.
I just haven't, they've gone to the business office and they've addressed those.
And Myron did that.
Yes. And I think he did get it resolved.
He wrote a check, that's why it resolved it. Paid his bill.
I believe that they made an adjustment to his name to make it to what it was.
Any other business? Let's just go home. Okay, adjourned. Thank you.